Ever wondered what total knee replacement is and why it is needed? Well, let's untangle this knot together. Total knee replacement, also known as total knee arthroplasty, is a surgical procedure where the weight-bearing surfaces of the knee joint are replaced with artificial parts to relieve pain and disability. Imagine it as a makeover for your knee, where the worn-out parts are swapped out for shiny new ones. Now, why would anyone need this? The primary reasons to consider this surgery are severe arthritis or a traumatic injury. Picture your knee as a hinge. Over time, conditions like arthritis can wear down this hinge, causing pain and making it difficult to perform everyday tasks. Traumatic injuries, on the other hand, can damage the knee beyond the body's ability to repair itself. In these cases, a total knee replacement could be the solution. So, buckle up and stay tuned as we delve into the detailed process of total knee replacement. Before we dive into the procedure, let's understand the anatomy of the knee. The knee, a hinge joint, is the largest joint in our body. It's an intricate system of bones, ligaments, and cartilage, all working in harmony. Firstly, we have the bones. The knee joint involves three bones: the femur or thigh bone, the tibia or shin bone, and the patella, our kneecap. These bones provide the framework for movement and weight bearing. Next, we have the ligaments. Four main ligaments connect these bones, acting like strong ropes to hold the bones together and stabilize the knee. These include the anterior and posterior cruciate ligaments in the center, and the medial and lateral collateral ligaments on the sides. Lastly, we have the cartilage. This smooth, rubbery tissue covers the ends of the bones, cushioning them and reducing friction during movement. Now that we have a basic understanding of the knee structure, we can better understand what happens during a total knee replacement. In the immediate aftermath of surgery, physical therapy becomes your new best friend. Starting as early as the day after surgery, a physical therapist will guide you through gentle exercises designed to prevent stiffness and improve blood flow. It might seem daunting at first, but remember, these small steps pave the way to your regained mobility. During the first few weeks, you'll be working on basic movements such as standing, walking short distances, and climbing stairs under the watchful eye of your therapist. It's all about rebuilding strength and confidence in your new knee. Now let's talk about rehabilitation. A good rehabilitation program is not just a recommendation, it's an absolute necessity. The goal is to restore function and strength to your knee, enabling you to return to your daily activities. This involves a series of exercises that gradually increase in intensity over weeks or even months. Patience and persistence are key here. The road to recovery is not always a straight line. There may be days when progress seems slow or even non-existent. It's important to remember that everyone's journey is unique. Your body is not a machine. It needs time to heal and adapt to its new circumstances. So, lean on your support system, communicate openly with your healthcare team, and most importantly, listen to your body. It will guide you on this journey, telling you when to push a little harder and when to rest. Recovery is a crucial part of the journey to getting back on your feet. Embrace it. For it is in this process that you will find your strength, resilience, and ultimately, your stride. Let's recap the key points about total knee replacement and its recovery. We delved into the basic anatomy of the knee, a complex structure that involves the femur, tibia, and patella, along with a network of ligaments and tendons. We learned how the knee functions, how it can be affected by injury or disease, and how this can lead to the need for a total knee replacement. The need for total knee replacement can arise from a variety of conditions, the most common being severe arthritis or osteoarthritis. This surgery can significantly improve the quality of life for those experiencing chronic pain or restricted mobility, bringing them back to an active lifestyle. Post-surgery recovery is just as crucial. Rehabilitation begins right after the surgery with simple exercises to regain strength and range of motion, gradually progressing to more complex activities. Physical therapy is a vital part of this process, aiding in restoring normal knee function. The importance of a dedicated and consistent rehabilitation program cannot be overstressed. It's a journey that requires patience and perseverance, but the rewards are worth it. The ability to move freely, to live without pain, to regain your independence. Throughout this journey, your healthcare provider is your compass, guiding you and providing you with the necessary information and support. They will help you understand what to expect, how to prepare, and how to navigate through the recovery process. In conclusion, total knee replacement is a significant procedure that can drastically improve your life quality. But it's not a journey to be taken lightly. It requires understanding, preparation, and commitment to the post-surgery rehabilitation process. Remember, every patient's journey is unique, and your healthcare provider is the best source of information for your specific situation. So we've covered a lot today about total knee replacement. It's truly remarkable how far medical science has come, enabling us to replace an entire joint with a prosthetic that not only relieves pain but also restores mobility. We've delved into the intricate anatomy of the knee, understanding its components and how they work in harmony to allow us to perform everyday activities. We've also walked you through the step-by-step process of total knee replacement, demystifying the procedure and hopefully allaying some of your apprehensions. The post-surgery recovery phase, as we've discussed, is equally important. It's the time when your body adapts to the new knee and you gradually regain your strength and mobility. It's a journey, not a sprint, and patience, along with adherence to your physical therapy regimen, will be your best allies. We've also highlighted some key points to remember. The decision to undergo a total knee replacement is not one to be taken lightly. It requires careful consideration and a comprehensive discussion with your healthcare provider. Each individual is unique, and what works for one may not necessarily be the best course for another. Remember, it's okay to have questions. It's okay to have concerns. Your healthcare provider is there to guide you, to provide answers, and to help you make the best decision for your health and well-being. The journey to a pain-free, mobile life after a total knee replacement may seem daunting, but with the right information and support, it is entirely within your reach. Knowledge, after all, is the first step to empowerment. So continue to seek out information, continue to ask questions, and continue to be an active participant in your healthcare journey. Thank you for joining us in this journey through total knee replacement.